Sakthi Dental Clinic, Mullukurichi. Root canal therapy, also known as endodontic therapy, is a dental procedure that involves removing the infected or damaged pulp, soft tissue, from the inside of a tooth and then cleaning, shaping, and filling the resulting cavity. The procedure is usually performed by a dentist or endodontist. The pulp inside a tooth can become infected or damaged due to a variety of reasons, such as deep decay, repeated dental procedures on the same tooth, cracks or chips in the tooth, or trauma to the face. If left untreated, the infection can spread to the surrounding tissue and cause pain, swelling, and even tooth loss. During a root canal procedure, the dentist will first numb the area around the affected tooth and then make an opening in the top of the tooth to access the pulp. The pulp is then removed using special instruments, and the resulting cavity is cleaned and shaped to prepare it for filling. Once the cavity is prepared, the dentist will fill it with a rubber-like material called gutta-percha and seal it with a temporary filling. In most cases, a permanent crown or other restoration will be placed on the tooth to protect it and restore its function. After the root canal procedure, the tooth may be sore for a few days, but over-the-counter pain relievers and good oral hygiene should help to alleviate any discomfort. With proper care, a tooth that has undergone root canal therapy can last a lifetime. Thanks for watching. Like and subscribe.